parents. It is Wednesday. It is just gone 8 o'clock. And welcome to Philippa Fabbri, Education Consultant, to our Wednesday night chat. This evening, we've got Tamarin Jakins. I'm so happy to be co-hosting this evening with her, and we're chatting about intellectual assessments, the who, what, where, why, how, everything that has to do with having your child's assessments done. And I must say, I'm here as a parent. Tonight, I'm not the expert. I am a parent that has been through educational assessments. I'm a teacher who has read educational assessments. So I'm on the other side of the fence. And Tamarin, my co-host this evening, she's the one that's doing the educational assessment. So I'm so thrilled to be able to ask the same questions that you as parents, I'm sure, have asked or are asking when you know that your child has to be assessed, or if your child has to be assessed. So this is going to be such an interesting discussion. Just a quick intro. As I said, my name's Philippa Fabbri. I'm an education consultant here in Port Elizabeth. I've been in the field of education for 25 years odd. I don't want to give my age away too much, but it feels like I have been immersed in education my whole life. Obviously, I spent 13 years at school, plus minus. Then I went to study, and then I taught. And then I did my master's, and then I've done my PhD. So this is my passion, and I really, really want to be able to help parents who are maybe grappling with some things that they are anxious about. It's been one heck of a year last year, 2020. 2021, we're forging ahead, and life goes on. And maybe, yes, maybe one day we will return to normality in some sense of the word, but at the moment we are dealing with back to school, and back to school means possibly an intellectual assessment. So yeah, as we sort of launch into this evening, I want to encourage you to maybe in the comments tell us where you're from. Let us know if your child is being assessed. If you're thinking of having your child assessed, let us know so that we can reach out to you and help you with the process. Yes, it is daunting. It is incredibly daunting. If there's something wrong with your child, immediately you think the worst, and you want to know why, and you want to know what you can do, and it is quite frightening. But we're going to unpack that this evening, and we're going to delve into the whole process so that if you are heading into that uncharted territory, we can help you and we can guide you through that process. So yes, without further ado, I'm going to introduce Tamarin, my co-host this evening, and she is a counselling psychologist here in Port Elizabeth. She has the Child Wellness Centre in Warmer, and if you'll just bear with me, I'm going to just read her bio. Hopefully I'm not going to need to put my glasses on for this one. Right, so Tamarin, she's a counselling psychologist. She's the director of the Child Wellness Centre in Warmer. She obtained her master's degree in counselling psychology, and she is currently working and deals with many, many children coming through her doors needing support. She identified the need for a multidisciplinary centre in Port Elizabeth, focusing on assisting children both academically and emotionally, socially. And so the Wellness Centre was started in May of 2015. She provides play therapy, assessments, developmental, school readiness, scholastic, psychoeducational assessments, and has a special interest in anxiety, ADHD, emotional and behavioral disorders, learning difficulties, acute stress disorder, and PTSD in children, developmental delays in young children. The Child Wellness Centre is a multidisciplinary child therapy centre focusing primarily on assessments and therapeutic interventions for children and adolescents. She has 3 counselling psychologists, a clinical forensic social worker, a registered counsellor, as well as a pregnancy and lactation consultant. The centre provides play therapy and assessments to children as young as 2 years of age until approximately 18 years of age. Adult, couple, and family therapy is also provided. She says our multifaceted team approach enables us to treat your child by adopting a holistic perspective, which has proven to be very beneficial and successful. Furthermore, the Child Wellness Centre's multidisciplinary team branches out to the wider PE area as we enjoy productive working relationships with other allied health professionals in private practice, such as occupational therapists, speech and language therapists, remedial therapists, pediatricians, audiologists, behavioral optometrists, as well as pediatric dietitians, and psychotherapists. And I must say, having been involved in special needs education and in the classroom, Port Elizabeth, being a small city, as opposed to a place like Cape Town or Durban or Johannesburg, we get to know our counseling, our psychologists, our pediatricians. It's so nice to be able to actually form a relationship with our private practitioners because we actually know them. We've met them. It's not somebody that you sort of have heard of, or you know the name but you don't know the face. We are so fortunate in Port Elizabeth that we get to know one another. And Tamarin, if I'm not mistaken, I'm going to bring you on now so that you don't feel like I'm ignoring you, putting you in the closet there. Hi, Tamarin.
Hello.
It's lovely to have you with me. So,
Thank
Tamarin, you and I met the first time, if I'm not mistaken. You did a talk for Priory parents not so long ago.
Yes.
And I was a parent there, and you spoke with Chris Breett. You spoke about, I think it had to do with drug abuse, or just, I suppose, enabling our children to identify the different, I suppose, temptations out there and knowing, the dangerous ones. I think you spoke about that, if I'm not mistaken.
Yes. They did a questionnaire and the results were a bit concerning. And so I think it was Father Grant, and I think at the time, Mr. Greg Stokel was still headmaster, and he invited myself and Chris on to just give some tips on signs and things to look out for in teenagers.
Correct.
Yes.
And then the next time you and I both spoke at the ADHD support group in Port Elizabeth.
Yes.
And I think you were dealing with that from a child, or maybe I attended, and then the next time I spoke and you attended. I can't remember.
I think so.
It was definitely the same event, and I just kind of enjoyed your energy and your warmth and your sense of humor. And so when I knew I needed to do this talk and bring on somebody to support me, I thought, I'm just going to call Tamarin because she's just the right person. She's just the right person. So I'm so happy you were able to do this. I'm so happy that parenting didn't get in the way this evening. So thank you for that.
Thank you so much. Now I have to say to everybody watching, this is literally huge for me to even agree, because because I am my co-workers and friends know when it comes to anything online, and just during this time of COVID having to do Zoom chats and meetings, I am so awkward online. But when you asked me,
fantastic. No,
thank you. When you asked me, I couldn't say no.
Yeah. Look at the comments. We've got Marley. Glad to be joining this talk as a registered counsellor working with Tamarin. What an amazing team. Whoop, whoop.
She's amazing.
There we go. Melissa Riordan. Glad to be here as a psychologist working in a high school setting. Oh, Melissa, you're at Grey, if I'm not mistaken. Grey High School, I think. So welcome. That's great. Please send in some questions so that at the end of the talk we should get to some questions. Hi, Christelle. Lucky to have you on board. Who else is there? Marjorie says hi. Who else do we have? Barbara. Hello. We've got Mandy. Hello. All right. So where are you from? You can let us know. I presume you're mostly in Port Elizabeth. Seeing that I've been pushing this out on all of my platforms, and I know Tamarin has as well. Okay, so let's delve in. So I'm going to start by, I suppose, my parent hat is on this evening. I've had the experience of having both my children assessed. My youngest child was assessed as a little chappy because we needed to know whether he was going to be school ready. And so he went and had an assessment to check that all his developmental milestones were sort of on par, and that he would be able to do all those foundational type skills to be able to manage in a formal school setting. So I went through that when he was little, so that's about 12 years ago. And then my oldest son had to be assessed for concessions. And then we went through the whole process of checking to make sure that if he did need extra time or if he did need some kind of a concession to assist him with his exams when he was in grade 10, 11, and 12, that he would get those concessions or that he would be eligible for those concessions. So, I don't know, Tamarin, I think, when I was thinking about what to call this talk, intellectual assessment, IQ assessment, psychometric assessment, there's so much terminology with regards to an evaluation. Can you maybe, I don't know, just what is it called? What is the right word to use if your child needs to have a scholastic assessment?
Well, it's actually, yeah, I was talking to a friend of mine also in the field, and scholastic assessment is the going term. However, there does seem to be a tendency amongst my peers and I that when we're assessing in high school, we do more refer to it as a psychoeducational assessment, but when you unpack it, it's really the same thing. I think it's just an interchangeable term. I know overseas they go a lot more tailored with the psychoeducational assessment. It wouldn't be a generic set of tests. So, for instance, that would be looking at a child and picking and choosing particular assessments to create a certain learner profile. And they incorporate a lot more learning styles, assessments into their psychoed assessments. But for the purposes of this talk, psychoeducational assessments, scholastic, for me, it's I'm going to be looking at the same things. So I would, yeah. I think we mostly say scholastic because we're
Scholastic,
looking
yeah.
at, yeah, academic
How they,
areas and
exactly.
yeah.
Yeah. That's mainly why a child would be referred, is because they're
Mm,
struggling they're struggling with something at school, whether it's an emotional issue or or an issue with maths or reading or spelling or writing. And
yeah.
so we call it a scholastic assessment because we want to know why they are struggling at school, why there's a delay or why there's a discrepancy between their ability and their achievement
Mm,
within the classroom. Um, Tamarin, I sort of jumped ahead. I wanted to know, we've gone through COVID, and last year was really a difficult year. Have you seen, or what kind of issues have you seen coming through your practice since March of 2020?
mm, mm. I think first and foremost, it's really been, and in chatting to the staff at the center, anxiety, incredible social anxiety. So with the fact that there's been lockdown and children aren't able to socialize freely like they did before, that's created a tremendous fear, almost a phobia of going out, of going to parties, of even going to school. In addition, the whole mask wearing, whilst children are generally really good with it, I think better than adults are, it's also bringing about other concerns, struggling to breathe. And of course, when the child is anxious, they generally do breathe faster. And so additional factors and concerns about how are they going to cope at school, how they're going to deal with if they get sick, if someone they know gets sick. So fear of being sick. And then sadly, also a lot of dealing with grief and loss due to having a parent passing away from COVID or a loved one. And also, I've seen, in speaking to my peers, young children being very afraid of Oma and Opa dying. So a lot of the anxiety to do with all of this. And it's actually
Okay.
bizarre. If I can just quickly say this, I was thinking about a talk that I often give, well, before COVID, on ADHD and anxiety. And one of the things I spoke about it with the anxiety part is how dealing with a child that fears a natural disaster like a tornado and how unlikely that is. And I think fast forward to where we are now, where we're doing this talk like this, it's actually unbelievable how things have changed in two years or a year. Yeah.
So, yeah, and I think that parents that are listening now, if you are dealing with anxiety at home, specifically with your child, maybe, schools go back on the 15th of February. If your child is anxious about going back to school and having to go outside and deal with mask wearing and being exposed to to whatever, I think now is a good time. You've got 2 weeks. I'm sure, Tamarin, am I not mistaken, that you can do a lot with 2 weeks. So if your child is struggling with anxiety now, worrying about school starting on the 15th of February, get hold of Tamarin, get hold of the Child Wellness Center, and chat to them, because it's better to rather be safe than sorry. So I just wanted to, off the bat, I mean, I know as well, dealing with the kids at Elson Academy and dealing with parents' anxiety, and that anxiety also does brush off on the children. We try not to, but it does wash over onto them as well. So maybe we should chat about the anxiety and the relationship between anxiety and ADHD, because the two can also seem quite similar. We might think it's ADHD and treat with a concentration medication, but there's an underlying anxiety, or vice versa. We might think it is anxiety, treat with an anxiety medication, and it's actually a concentration issue. So won't you just chat quickly about how to tell the difference between the two?
It's not always easy, because generally when a child is dealing with anxiety, the very symptoms that they show would, in a classroom environment where they have to concentrate and work, would show up as ADHD symptoms. So your lack of attention, struggling to focus, very aware of others around them, having to be brought back to task. But often it's the cause of that behavior that distinguishes what it actually is. So an anxious child, the cause of that behavior is because they're anxious and they're concerned about a particular thing, and often it's to do with schoolwork. So you'll see children, there's like a trend, if there's a particular subject area that creates tremendous anxiety. I mean, for me at school, it was maths. I'm pretty sure that in maths I must have looked like a proper ADHD kid, because I just,
Ma'am, can I go to the loo? Ma'am, can I go to the
for
loo,
sure,
ma'am? So
I
that you
didn't
could be
know
out
it
the
was
class
possible
as
to
much
go to
as
the
possible.
toilet so much during a maths class like I did at school. So, yeah, so those types of things. But with a proper ADHD, and when I say that, I don't mean that you get fake ADHDs, but where it could seem very much like it. There's often there's a problem within the executive function of the brain. So the planning skills, organizational skills, there's often so many other little symptoms there that you can pick up when the child is not in a very distracted state, if that makes sense. So problems planning of their work, forgetfulness, yet there's no apparent mood component to it that would signal anxiety. Anxiety has always got a mood component there, because they generally are on edge, but they immediately can relax when it's break time. Whereas an ADHD child, they're on the go constantly,
All the time.
all the
Helen,
time.
yeah.
Yeah.
Okay. Okay, what other red flags would teachers be seeing in the classroom? And because these red flags are being seen, they're referring to you. So what are some of those red flags?
Well, I
Besides
think
anxiety and ADHD.
I was just about to say anxiety and ADHD. But yes, though, we do see a lot of things. So in terms of attention, so I think avoidance of tasks. That's been something that often parents come to see us, and they get told you need to do an assessment. But when you try to find out what type of assessment, I think parents often themselves aren't entirely sure. And I just want to say this about ADHD. People often don't realize that when you need to assess for ADHD, you need to do a scholastic assessment, because that is how we can diagnose it. We analyze score profiles. We see if there's a scattered profile, fluctuating scores, etc. So we do a scholastic assessment, because we can analyze through the answering if there's a significant ADHD thing. We can also pick up anxiety in that too. So things like that. When it comes to an undiagnosed learning disorder, you often see frequent careless mistakes being made. By the way, if I keep looking down, it's not because I've got a tick or something, it's because my notes are actually, so I thought I'd just mention that and have a bit of a lighthearted moment. So people are like, this girl needs to be seen because she keeps on doing this like a cockatiel. So untidy handwriting, spelling problems, things like that. So, those are often signs of a learning disorder, struggling to read, where they should be acquiring and learning skills in relation to their peers in reading and writing and all of that, but yet they are struggling. So they're falling behind their peers consistently,
Not finishing work,
um, not,
not being
yes,
able
not
to, yeah,
completing
not
work.
being able. Mm.
Yeah.
Just thinking of, I'm
Also,
just, yeah.
mm,
No, I'm just thinking
yeah,
of if it's not subject related specific, it could be just a general kind of, not able to start work, not able to finish work on time, or rushing through
yeah,
work,
yeah.
producing, work
Lack of
of a poor
interest.
quality, lack of interest. Yeah. So I see
I
there are lots of
often,
teachers
yeah.
online here. Sorry, I don't
Mm,
mean to interrupt you, but here, I'm a mom and a teacher from Port Elizabeth. There's Lauren. We've got Mary, who's a teacher, and she's a parent also. Hi, Mary. We've got Linley, who's a teacher and a parent at Herbert Hurd. Hi, Linley. We've got Desiree from Swaziland. We've got Cherie. So there are lots of teachers on here as well that are parents. Hello. We're all in the same boat. We wear two hats. So
yeah.
yeah, I think we've got teachers on the chat. So yeah, maybe Linley, you can pop on the chat. What do you see? Why would you refer a child to Tamarin, let's say, or Mary, you're also a teacher. Why would you refer?
Mm,
Because it's so important that we've got the teachers who are in the classroom and seeing these little red flags. When we refer a child for an assessment, it's not just for the sake of, I don't know, it's like we're just looking for problems. It's because we really, really are, we're confused because we're wondering why this child has got this aversion to work, or they've got this sort of underlying anxiety, and we really want to get to the bottom of it so that they can, achieve success.
mm,
Um,
mm. I
Wendy,
think it's
Wendy's
also
a
too
teacher. Hi,
important
Wendy
to
from Cape Town.
mention that
Yes.
an assessment is to also identify a child's strengths and weaknesses, and so how you can
Mm,
harness those to really optimize how they learn through the right support and intervention,
mm,
through developing an individual education plan. So it's not necessarily that a child needs to be struggling significantly
mm.
um, for a referral to be made. I think if your gut feeling is telling you, and I always say to teachers, what does your gut tell you? Because
Gut.
if you can pick up, and also it's the qualitative stuff. It's seeing that child. You can look at a classroom of kids and you can pick out those children that you can immediately see, obviously, your ADHD, but your anxiety, the children who seem insecure and unsure of themselves. And even if their work comes in and it's adequate, there's a continual theme there, not theme, like a
Trend.
trend
Mm,
that they're struggling, they're working exceptionally hard to produce what they are.
Okay,
And let's see
here's
how
a
we can make it
comment.
easier. Mm,
Lindy says discrepancies between written and verbal ability,
mm,
concentration, not completing tasks, poor social skills. Yeah,
yeah.
that's it. So,
Mm,
so Tamron, again, um, as a lay person, what is the difference between a counseling psychologist, a clinical psychologist, an educational psychologist, a registered counselor, and a psychiatrist? Do you
no,
all
don't ask
do
me that.
those tests?
Don't ask me that.
How
No,
do I
listen.
know who to refer to?
Okay, so currently at the moment, oh my gosh, listen, my friends in the field, please don't crucify me because it's currently a debate, and the scopes of practice have been argued about in court and all of that. But essentially, we've all been trained in the same assessments. Oh, the educational psychs are going to kill me. Um, We've all been trained in the same assessment, so we can conduct, and I say that in all respects, because I think
Mm.
the one thing I've noticed is that it depends on where you live. Port Elizabeth, we don't have very many educational psychs, so as a
I was just going
result,
to say, are there any
yeah,
left in Port Elizabeth? But anyway,
I
continue.
know of two. So As a result, our training, I mean, educational psychology stream isn't even offered at masters. Yeah, so we are all trained in doing scholastic assessments, etc. Our internship sites we placed at schools, we placed at the university Euclid. So we've all been trained in doing that. So you actually won't go wrong in referring to any of those. Research psych, they literally do research, so they're not trained to work face to face with clients, providing
Well, I
counseling,
can tell you now
assessment,
how parents will find out who to go to. They'll ask on Facebook. They'll say,
mamahood.
yeah, exactly, or the village, or Port
Yes.
Elizabeth girls, no men allowed on the group, or whatever. They'll say, my child needs to go and see a psychologist. Who would you
Yeah.
recommend? So
Yeah.
immediately we go to our village and we ask our elders, or we ask people who have been there, done that, who would they refer to, or who would they suggest? Otherwise, the other option is I'm just going to go on to Dr. Google and I'm just going to
Yeah.
type in there psychologists near me, and
Yeah.
I'll just see who comes up, and I'll go eeny, meeny, miny, mo, and hopefully pick one. But I think the rule of thumb is to go to the teacher and say, because we have dealt with all the psychologists over the various years that we've been in the classroom, and we would then know, all right, these are the ones that we have used often. These are the reports we like to read. These are the people we like to pick up the phone and chat to. And so we could give them a list of, let's say, 5 or 6 names and say, these are the, you can't sort of say, use this one, because I don't think that
No.
would be ethical. But you can certainly
Yeah.
give them a list, and then they could choose who to refer to. Okay, there's another question coming through, so just bear with me. I'm going to put my glasses on because I'm old. Mary, my concerns are obviously educational discrepancies, but more emotionally connected. When children are anxious about not being able to finish tasks along with their peers, they start becoming labeled by their peers, feel like they are, and they call themselves stupid, dumb, or emotional. 100%, Mary. Spot on. Spot on. Yeah. So they immediately see that they are not doing as well as their friends. And they start to question why. Why don't I write as well as Jane? Why don't I finish my work as quickly as John, etc.? So they know immediately that they're not, on par. Adele says, hi, Tam and Philippa, thanks for chatting through this. Just flagging scholastic assessment, not just for learning difficulties in ADHD, but also give to children who may be bored, understimulated. Anxiety also with presenting with perfectionist traits, and also interesting dynamics we see when assessing. Yeah. That's
So
a
I
good
must
one.
just
That's a good
say,
question.
Adele
Yes.
works at the practice.
Hi, Adele. Good to meet you. Fantastic. Fantastic.
Yeah.
Yeah, I love that
Totally,
question. The
Adele.
gift to
Yeah.
children. Yeah, yeah. I'm sure there are lots of
Yeah.
children who sit in class and they're bored, and they're not stimulated, and they also get frustrated and anxious because, again, they don't understand why their needs are not being met as well. So they're bored and they start acting out, and those behavioral issues come in there. Desiree is asking, have you come across parents who are in denial about their kids' behavior? They expect you to change the child's handwriting, behavior, etc. I don't know, Desiree, are you referring to a teacher, or are you referring to the psychologist to change the behavior, change the child's handwriting or behavior? Because I know you don't work, I mean, Tamarin, I'm right, you do the assessment and then you refer. If the child, okay, so maybe we're jumping ahead here. So when you've done the assessment, because we are running out of time, when you've done the assessment, Tamarin, and you then write, yes, we're already at past, and then you write a report. What goes into that report? So I've delved out of my file. I got my son's report. He was assessed actually when he was 13. He was at Clarendon in grade 7. He was assessed then because he wasn't finishing work, and his concentration was an issue, and he was the class clown, and blah, blah, blah. So we did an assessment there because we wondered about ADHD. And then he had another assessment in 2017 because, like I said, we needed to see whether he needed extra time for concessions, because he was diagnosed ADHD, but obviously during exams there was anxiety that would come into place there, and he wouldn't finish work. So looking at the test here, we have these different sections in the test. So, Tamarin, when you look at, I mean, again, as a parent, obviously the background information, you would then talk to me as the parent before you even see
Yes.
my child. You would then spend some time with me saying, okay, tell me, why are you here? How can I help? So you'll spend that
Yeah.
first session with the parent, eh?
Yeah, yeah. Maybe what I could do, Phil, I'm just thinking just to kind of give a rundown, which I think could maybe be a dual purpose because it could kind of explain what goes in the report as well as what we assess
Yes.
skills wise. So the process is that very first appointment, we like to meet with the parents, ideally both if we can, but I know in this day and age it's not always easy, but it's very interesting to get both parents' point of view on the child's issues. And often that's when you pick up history, family history of learning issues. Or as you are asking questions, it brings up a thought of possibly my father had issues with reading and writing, etc.
Correct.
So we need to get as much of a history on this child as we possibly can. So I always say to the staff at the practice and that I said, let's see ourselves as like PIs, we're investigating. You need to go back to infancy. You need to go back to as babies, what age was the child when certain milestones were actually reached? Were they on time? Were they a bit behind? Were they early? Look at educational history. When was the very first time any difficulties were reported? And then looking at medically also, are there any health concerns that we need to know of? Are there problems with hearing and sight and all of that? Are there any emotional behavioral concerns that you're dealing with, or has your child been to see a psychologist or a social worker or a counselor before with support? So you really need to get as comprehensive a picture. It's not that we're being nosy Parkers and we just want to
No,
know
no.
your entire life story. Um, I've often had parents say to me, "Do you really need to know all of this?" But it is amazing how when you pick up something in assessment and you go back to your notes as well, you see it's all making sense. So also in that appointment, I also say to parents, if possible, don't bring your child with because it's not always easy to talk
Speak
freely
in front of them.
unless, yeah, unless they're of an age where they are teenagers and they want to be there and, so super. Then for the assessment portion, we look at three components. We look at the intellectual aptitude, if you want to call it that. So that would be your IQ test. And the IQ assessments that are predominantly used currently is the SSR. So that would, your IQ is made up of verbal skills and your non-verbal skills. So verbal skills would be things such as, and I've made notes because I'm a mom and I'm worried I'm going to say something wrong because she's small and teething. But things like in the verbal set, your vocab, your similarities between different things, comprehension, looking at numerical reasoning, and also logical reasoning, memory for a story. So the auditory side, can the child recall what they've been told and what they've been read out to? Um, Memory for digits, so can they recall number sequences? So this is looking at things like reasoning, memory, auditory, comprehension, language, all of that. And I'm really not doing it justice because I'm aware of time, but that's your verbal. Then your non-verbal is very much focused on the visual, perceptual, and spatial and the practical manipulation of objects. So things like completing, where they give them a pattern, if you could call it that, yeah, where it's like awkward and then they've got to like do the like a sequence and then the fourth block they need to complete that, but it doesn't starts off easy and then it becomes a lot harder. Block designs where you get a book and the child's got to build blocks to resemble that. Missing parts and form boards, so like also like insets that they need to organize because they've got to perceptually arrange it. And then coding would be how quickly they can match numbers with letters according to a key, and it's timed. And often, if there's a significant difference, that would be of 12 points between your verbal and your non-verbal skills. That's where we pick up, okay, this is a significant gap. This is more than what it should be. And there's a verbal learning issue here or a non-verbal. So the one area
Okay,
is
so are
much
you
stronger.
looking at left brain versus right brain ability when you say verbal versus non-verbal? Are you
You could
kind of
say
looking
that.
at, okay,
Yeah, without really saying left brain and right brain, because then you
yeah,
could go into a neuropsychological angle also. So, but essentially, your verbal and nonverbal, it's interesting that the nonverbal plays a major role when it comes to reading and spelling and writing and maths, because perceptually, those are the foundational skills in reading and writing. So if you are able, if there's a problem there, often you can't be sure that the child sees what you see. So with a dyslexic child, often in an assessment, their perceptual skills will be quite poor, because there's a definite issue there where they don't necessarily see what you see. They make reversals of letters, etc., um,
okay, then that
spelling, all of
that you're going
that.
to pick up in the scholastic part of the test, hey, when you do your the
Yeah,
reading and the spelling and the maths
yeah.
subtests.
Which brings me to my next section, um, which is your reading, spelling, and your writing. So we do a reading test, a spelling test. We also try to see sort of the equivalent of where they are at. So not just where they are right now, where they should be, but if a child is in grade 5, but their equivalent is of a grade 3 child in term 2, for instance. And that way you can also pick up, you can really unpack the significant issues there. So is it a problem, for instance, in reading with their sight word vocab and the ability to, translate what they see into words, and then spelling the same thing, looking at phonetic spelling, and are they able to decode what they oh, I'm getting myself mixed up here, but basically
Decoding,
to
the decoding of the
thank you.
words. Yes. They
I tried
decode
to
what
not
they
look at my
see.
notes. What's that word? So basically, spelling, reading, you're looking at your maths as well, and then we look at your perceptual skills. So your Bender Gestalt test looks at the perceptual skills, and the Rag complex test, and then we can do memory tests, so auditory, memory, verbal, to see are there any issues there. We can do a processing speed test, which is a trail making test, they call it. So all of this is to pick up, do we have any problems with the child's ability to store what they've learned? Because inevitably, if there's a problem with reading and spelling, there's a problem with auditory processing, and there's a problem with memory. So it all ties in to the recommendations. And again, this topic is something that we could spend 5 hours on, because it can be so technical, but I don't want to overwhelm parents by giving too much info. Then just lastly, then looking at the behavioral and social, we do rating scales. We give rating scales to teachers and to parents, and
Oh,
I'm sure
yes.
teachers
I was going
know
to
all of
say
them
that.
well.
Sorry, I was going to say that's the other important piece of the puzzle is that you
Mm,
sit and you speak to the parents and you get the parents' situation. And then it's so important to speak to the teacher and get the teacher's perception as well, because
yes,
often what the teacher says and what the parent says might contradict each other. So it's so
yeah.
important to get both sides of the story, so to speak. Okay. So what do you give the teachers to complete?
So we do a rating scale on, I'm not going to mention names because I think it'll all be clear when the parent comes for the assessment. But so we focus on attention and concentration, hyperactivity, daydreaming, so all those components that would look at ADHD symptoms. Um, and then we look at also the ability, the emotional state of the child. So how do they cope when they're exposed to stressful situations? So is it a child that's quite dependent, so needing help all the time? Is it a child who represses how they feel because it's actually too overwhelming, and then they lose it when they get home, because at school they don't ask anything and at home they just don't know what to do? Then it's your overactive child that's on the go, and then it's also the very impulsive child. And then looking at temperaments also and how they deal with um,
The
situations. Is a
stress.
child, yes, are
How
they
do they deal
inclined
with
to
stress?
overreact? A lot of it is to do with stress, anxiety, how they cope, and attention factors. And I think really, without simplifying it too much, we're very interested in our assessment on that part of it, because even if, and I can't speak on behalf of anybody else, but if a child comes back and they are literally scoring fantastically on everything, but the rating scales show a child that's severely stressed, there's something really, really wrong here. So even like Adele said, even if they are very bright, but the anxiety is causing perfectionistic traits, it can result in them taking much longer to complete tasks, and they can often struggle in timed tests, not because they don't know what they're doing, but the mere fact that they're being timed, they struggle to calm down and be able to just think and do that work. Um, blah,
Let's see
blah,
another
yeah.
question. Yeah. We need to do a webinar on the 3 assessment things they look for. So she's asking about, so you're looking at the IQ, you're looking at, or in other words, you're looking at the cognitive ability, you're looking at this subject-based ability with reading, spelling, and maths, and then you're also looking at the behavior and how they deal with the emotional stress of being assessed and having to solve problems with a strange person in the room watching and writing down on a piece of paper, which also brings me to how you prepare your child for going to an assessment appointment, and I suppose how to prepare the parent to prepare the child. How would you
Firstly,
recommend?
don't tell them that they're coming for an injection, because I've literally had a parent dad who thought he was, it's actually just so bad. He thought he was being so funny because he's got a very playful relationship with his child. And so in the waiting room, he told her, so you're now going to go to the doctor, and I'm not a doctor, go to the doctor and she'll give you an injection. Well, listen, that backfired big time. This child was in a complete state, and I spent at least half an hour of that assessment appointment confining her, containing her, and showing her that I'm totally not at all, I hope, what you expected. So, you need to also...
So what do you say? Do you tell them the truth? Do you say, we're battling with things at school, we're going to go and see Auntie Tamarin, and she's going to see how we can help you to work better at school? Or what would you say?
I think it depends on the child. If this is a child that your anxious kids need a lot of planning, they need to be told what to expect. So I think in a case with an anxious child, I would say to the parent, let me meet with them first. Let's not do an assessment first. Let's just have a general appointment. Come into the playroom. We can just play. They can get to know me. But I would say if it's a child who is generally concerned about schoolwork, always phrase it in a very positive way, that we're doing this to help you, that not all kids who do these tests can do all of it. They're actually not that bad. I've had so many children say in the assessment, this is not at all what I thought. This is so much nicer than school. And an absolute bonus, parents, is to take them for the assessment during school time, because it has to be in the morning, and time it for a subject they really don't like.
The worst subject.
Totally. I'm telling you, and you tell them about all the snacks that they can come, not that we provide because we're not a restaurant, but that they can bring. One kid brought sushi, love it, with her chopsticks, bless her heart, 8 years old. Yeah. So, make it seem like, so what they're missing out on.
Going for a tea party with Auntie Tamarin.
Yeah.
Yes. Okay. So in other words, be honest about it. But make sure that they know exactly what to expect.
Yeah.
It's not an injection? No.
It's not an injection.
No. Okay.
No. And
so
it's not
there's
a vaccine either.
No, it's not. Due to COVID and children only having 2 or 3 days of class, is this not causing more harm? In terms of academic ability or in terms of their emotional well-being? I'm not sure. But I think if I speak on from my perspective, I think we've got to look at what is best for the children. So we have to try and limit the numbers of children that are sort of in a school environment. So if the school has got a lot of children, they're having to do a rotational type system where some children are there for Mondays, Wednesdays, and Fridays, and then the other children are there for Tuesdays and Thursdays, and whatever the situation is. Obviously, every school is different. They've got to look at numbers. They've got to look at their resources and how they're going to spread the children out safely. And I think that is the most important thing. I mean, I know a lot of the private schools have gone back because you're looking at a lot fewer children, so it's easier to do the social distancing. But obviously, we've got to be mindful of the public schools and the children who are sitting with 40, 50 children in a class. To try and socially distance is very difficult. So, I think every school is different in terms of that. Um, yeah, let's move on to the last section. There is another question. Is Tamarin a therapist or a teacher? Is that the WhatsApp number showing in the screen? Okay, so Desiree, Tamarin is a counselling psychologist. She's at the wellness center, the child wellness center. The number is the landline that you can get hold of them there. My background, I'm a teacher, I'm also a parent, so I'm asking the questions tonight, and Tamarin is the expert on the spot tonight. When we do another webinar, we might do something else in terms of, I suppose, maybe coping skills with COVID or getting back into the routine of schools. In fact, I'd love to get some information or some advice or some ideas from you, if you're still watching, of what further topics you'd like to have on Wednesday evenings. The plan is Wednesday evenings at 8 o'clock will be the time. Every second Wednesday will be a longer webinar, so it will be a good 45 minutes. And then the other Wednesday we'll do a quick Ask Me Anything, sort of 10 minutes, fire a question at me and I will answer it. So yeah, I'd love to have some more advice or ideas of what else you'd like to hear from us. But just in closing, Tamarin, in terms of concessions and exemptions. So again, at Elson Academy, we go all the way to matric. We have children writing matric this year. When they get to grade 10, all of a sudden now things tend to become a lot more formal, and children need to have permission from either the Department of Education or the IEB, whoever they're writing the exams with. They need to apply to those external examination bodies for concessions. So again, can you explain quickly what is a concession in terms of an exemption? Can they get exemptions for, let's say, maths? And how do you know when your child could potentially need an exemption or a concession?
Well, Phil, I'm hoping you can answer the maths exemption one because I'm not 100% sure. I know that there is a possibility to be exempt from maths. I know with the IAB schools, even though from the limited experience that I've had, because it's very rare, but you've got to prove a maths disorder. There's very stringent steps because otherwise I think it can be abused with if I just don't like maths. I mean, listen, if I could have a choice, I would have been exempt from maths when I got into grade 1. So there's certain steps. So I'm hoping if you don't mind answering that because you are the expert actually when it comes to that particular thing. But
maybe you can talk about what tests you would have to do in order to get that exemption. Yeah.
So I know the IEB are very particular with what they want, but in general, you would need to do particular assessments. So you've got I think it's the Wyatt, which has got a numerical subtest there. We've also do mostly the arithmetic tests, BASI, all of that. But to be honest with you, I think it's something that it's asked. It's an issue more when they're in high school. So in general, we wouldn't just do one test. It would be part of a scholastic assessment. You would look at your perceptual test. You would see if there are issues there, because if there's perceptual issues, then that would explain why the maths issue is there. So you would go through the same assessment battery in the sense, but with a greater focus on maths. You wouldn't just say do a maths test if a child comes in. And then when it comes to other things like readers and scribes and spelling, sort of passes, if you could call it that. So that's for a child that's got a reading disorder. So now they're called specific learning disorders with impairment in reading and written expression. So with your maths and your spelling and comprehension and all of that and writing. And so if there is also a slow processing speed, I'm getting a bit tongue-tied with all the terms. You can apply for extra time. So you can apply if it would benefit that child, and we could see a more accurate indication of how they would do. You could get a reader, someone to read for the child if the reading is so bad that we can't really tell that what we're seeing is a true reflection of their skill. A scribe, so somebody to write. For ADHD
Yeah,
kids, you could get a
I
prompter.
think
Mm,
exactly, and I think there's a lot available, and parents
mm,
need to advocate. You need to advocate for your child because these assessments are available and are there for a reason. So you don't want to send your child into right matric when you know that they've got a specific learning barrier that could be overcome if they had that concession. So I think it's so important that we don't penalize or disadvantage children because they might be a slow reader, or they might struggle with understanding what they read, so their comprehension is poor. We know how important it is that to be able to answer an exam question correctly, you could study all night long and know that information back to front. But if you are misreading that exam question, or you are not able to comprehend that exam question, all that effort in preparing for that exam is really a waste of your time. So I'm appealing to parents, if you know that your child is struggling in a certain subject at school, please, please, please do something, get them the support that they need, which brings me to my last little rant, is if you are going to send your child for an assessment and you have that scholastic assessment done, it costs a lot of money, it takes up a lot of time. Please, please, please make sure you follow through on those recommendations that will come from the psychologist who's doing that assessment. Usually there's a list of recommendations, and again, a lot of thought and a lot of time and effort has gone into making those recommendations. Follow through. If there's a recommendation to go and see a pediatrician, do so. If there's a recommendation to go and see an occupational therapist, do so. Because if you don't follow through, that assessment is a waste of your time and a waste of your money. So maybe just a final, I suppose, just a suggestion, or what is the most important thing you want parents to understand once the child has been to you and you sat, because usually you would sit and give feedback with that report. Then the next step, then they say, bye-bye, Auntie Tamarin, off they go. What then? Do they see you again after that?
I always leave a open door where I say to parents, please, and a lot of parents have taken me up on that because look, I've been to a doctor's appointment for myself, and when you're feeling anxious about something, health-wise or like this, you are overwhelmed. You don't remember everything. Our reports, and I just want to say this also, Phil, is that, our reports are almost intended for three different audiences. Parents, but we also, I know for myself, I include a lot of detail in our Child Wellness Center reports because I know that there are teachers that are seeing that. They need to be able to take that document and apply what we've asked them to, and the various others that we've referred. So, I think at the end of it, if you are unsure of what is there, if you want to ask a question, I always say to parents, pop me an email, come and phone and make another appointment. I will chat
It's
you
not the
through
end,
things.
that
It's not the
time.
end.
That's not the end. You've now got
Yeah,
that relationship. You've now your foot is in the door. That report is a link between you and
yeah.
that psychologist. And I promise you now, the teachers at the school, if they do what they're meant to be doing, that report gets placed in the child's profile and is kept on file. That report follows that child from grade to grade. And if necessary, if you need to repeat the assessment, because you usually cannot refer to an assessment if it's more than 2 years old. Am I right, Tamarin, or is it a year?
It's a
It's
year,
Is it a year?
ideally, yeah.
Okay. So in other words, you might need to have a reassessment done, which is why I had to do so. The first time my child was in grade 7 and then again in grade 10. So we repeated the assessment. So it's also good to compare. So now, to prepare for this talk, I actually went through that report and I compared notes. I wanted to see what he was like when he was in grade 7 and what he was like in grade 10. It was quite interesting for me to see what had changed and what was the same. So, yeah, I think, as parents, yes, it is an overwhelming experience. Yes, it is quite scary. You don't want to know that there might be something wrong with your child, but it's so important that, you follow through with the recommendations, you maintain the relationship with the psychologist that did that assessment, and maybe if you do need to repeat, you go to the same person because they've already identified or they already have a rapport with your child. There's already that relationship there. And it's always nice to just go back to the same person again. So yeah, I think there's one question here, Melissa. Please make sure your child's school receives the report and check that they are implementing the recommendations made. Absolutely, 100%, 100%. Otherwise, if we're not working together, parent, school, child, then it's a team effort. It really is.
I also want to say before we close off is that, and I think also just to illustrate further the point about why recommendations are so important, and maybe the term should be not so much recommendations, but the proposed intervention plan. When I do reports, it is a proposed intervention plan that I believe is going to help your child. And in that feedback, I'll explain to parents, if you cannot afford all of it, I would emphasize this first, that you do this, and this. But when I've done a reassessment and I've seen a child that has had a 12-point difference between their verbal and nonverbal skills, or even more, through those kids that have the parents where they've implemented those recommendations, and not every now and again, my OT friends often complain, and friends in the speech fields, that people don't always understand that it's a process. It is not an overnight fix. It does take time. It's taken years for this problem, learning difficulty, to have become to the point that it has now, where it's affecting schooling. So please don't expect that the remediation is going to be overnight. It's going to take time. But I've seen with children, when they do the work, there's like that switch that comes in. And I've seen with the reassessment, because of that approach, their difference has lessened. And it's amazing. So it can be done. I think parents often are so despondent, and I understand totally why. I promise you, parents, for us as psychologists, when we score your child's test and we see an IQ that's below average, or lower, or any other score, we feel crushed for you, because we agonize over how are we going to tell you. So we are on your
But then
side.
the positive on that is when the work goes in and the interventions happen and the
Yeah.
recommendations are followed through, that score can improve. And you can see
Definitely.
a completely different profile if work has gone in. So in other words,
Yeah.
that score can change. The brain can
Yes.
change. It's not
Yes.
something that's static. And I think that's also very important, that parents understand that when you get that result, it's not the be all and end all. There's a lot that can happen. At Elson Hour, we have a motto, it's no limits to learning, because there is no limit to your child's ability.
Yeah.
There's a score, but there's so much more than just the score. So I think we need to just ensure that parents understand that, the outcome, whatever you put in, you're gonna get out. And it's the same with the teacher. If you teach with the brain in mind, so you're teaching that child with all their little emotions, all their little personalities, their characters, their quirks, you're teaching that little person. But the most important thing is that there's a brain there that is developing, and it's growing, and it's changing. And I think for us as teachers, that is the most exciting and the most awesome responsibility that we have, is to get that child from point A to point B. At the end of the day, when our children are graduating or finishing school and they manage to get through, no matter what trouble they've had throughout their school days, if we can just get them through to the other end of the other end of the journey, then we can really pat ourselves on the back. So Lauren, I'm going to read the last question. I find this is Lauren. Tamarin, this is Lauren. I know Lauren
Yes.
also. She's with Sue Rist, isn't she? She's at the Mouse
Yes.
House.
Yes.
Hi, Lauren. I find the reassessment is very important as it allows you to monitor progress and adapt the intervention plan based on the child's progress. So
Yeah.
that's why it's so nice to see a child again,
Yeah.
whether it's a year later or 2 years later,
Yeah.
to just
And
see the
in our
progress that's been
reports,
made.
that last sentence is, please come back over maybe 6 months time for a reassessment. Often if it's 6 months, it's for me when the child needs, we need to really do these interventions, and let's reassess ASAP as soon as we can. You can't reassess sooner than 6 months. So please read that line. It's not a, oh, and have a nice day line. It's we really do want you to come back. And we want you to implement everything, because like Lowell says, the reassessment is vital. Um, and you can see with the reassessments those parents that have really tried everything.
Follow
And
through.
you know what, guys, I understand that finances are tough. So if you cannot afford all of it, be honest and let us discuss as a team how we can make this work. We have got incredibly kind people. I'm not saying now we're all going to see your kids for free, but don't be shy to speak up and let's see what can be done.
Yeah.
So, yeah.
Thank you, Lauren. Thank you for that
Camera.
question. It's a very no, but
Oh, Lauren.
I'm glad that Lauren piped up, because I was hoping that either Lauren or Sue would be watching, because the Mouse House is also, we refer to them a lot. They're great, and it's so nice to know that our messages are getting out to other psychologists and other people in this field. Like I said, P is very small. We all need to work together. We all need to refer to each other. Times are tough. So, yeah, Tamarin, thank you so much. Thank you for this exciting topic. It's kind of something that I suppose we should. That's lovely music. This is where we say good night and drive safely. No, we don't really say that. I'm gonna put you backstage, Lauren, but Tamarin, but don't disappear. Okay. Okay, so I just want to close off this evening, and I thank my co-host Tamarin for sharing this I don't know what that was, sharing this webinar with me. I don't like to call it a webinar because that sounds so formal, but it really is lovely for me to connect with parents. Like I said, it's going to be every Wednesday. We'll have different people on. It's so nice to have somebody else to co-host with me. And I did ask if anybody has ideas of what other topics we could discuss. Please send them through, and send through any ideas of who we can approach to co-host with me. But thank you so much for watching. We have gone a little bit over time, but it was worth every minute. And thank you to Tamarin, the Wellness Center. The number is on the screen, and I will be able to, if you want to email me any questions, or if you want to get hold of Tamarin, please let me know. But thank you so much for watching, and we will see you next Wednesday at 8 o'clock. Thank you. Bye-bye.